Good evening. Welcome to the TradNurse podcast. Today is episode 25. And today's show, we're going to reclaim the timeless wisdom of Catholic nursing. In a world that's forgotten its roots, I'm taking you way back before Florence Nightingale revolutionized things in the 19th century, before Big Pharma turned medicine into an industry. We're talking about the golden age of truly vocational nursing, when sisters, nuns, monks, and religious orders cared for the sick as an act of love for Christ himself. If you've ever wondered how nurses tended to the ill for centuries, without synthetic drugs, IV drips, surgeries, or even basic antibiotics. Spoiler, they did it with profound faith, herbal knowledge from monastic gardens, and unbreakable charity. So first, the big picture. Catholic nursing did not start as a profession in the modern sense. It was a vocation, born straight from the gospel. Jesus said in Matthew 25, "I was sick and you visited me. Whatever you did for one of the least of these, you did for me." That wasn't poetry, it was a command. From the earliest days of the church, Christians cared for the sick as a way to serve Christ directly. In the Roman Empire, pagans often abandoned the ill, the sick, leaving them to die on riverbanks or isolating lepers without hope. But Christians changed that. By the 4th century, figures like St. Basil the Great built the Basiliad, a massive complex with hospitals, hospices, and care for the poor. St. Fabiola founded one of the first true hospitals in Rome around 400 AD. These weren't just shelters. They had dedicated caregivers, often deaconesses, providing hands-on care. Fast forward to the Middle Ages, monasteries and convents became the heart of healthcare. The rule of Saint Benedict of the 6th century put it plainly: the care of the sick is to be placed above and before every other duty, as if indeed Christ were being directly served by waiting upon them. Monks and nuns ran Hôtel Dieu, God's hostels, like the famous Hôtel Dieu in Paris, founded in the 7th century, and staffed by Augustinian nuns for over 1,000 years. What were the core principles guiding this care? Let's break them down. The first is charity as the foundation. Nursing was the corporal work of mercy, feeding the hungry, clothing the naked, visiting the sick. But it went deeper, seeing Christ in every patient. Sisters treated the poor, pilgrims, plague victims, soldiers, everyone. There was no discrimination. Also, number 2, holistic care of the body, mind, and soul. Physical needs came first, but spiritual care was inseparable. Patients received the sacraments right away: confession, the viaticum, and extreme unction, last rites in the Catholic faith. Prayer surrounded the wards. The nurses prayed before every shift. They prayed with their patients. Daily Mass was offered, rosaries, litanies. Healing the soul often brought peace that healed the body. Number 3, humility, obedience, and self-sacrifice. Religious life meant poverty, chastity, obedience. Sisters saw nursing as a prayer in action. They risked contagion, worked endless hours, and asked nothing in return. Patients were treated as masters of the house, with respect and comfort, and most of all, dignity. Number 4, hospitality and dignity. Clean linens, as clean as possible then, good food, rest, fresh air, The hospital wards were designed for ventilation and light where feasible. A standout example, the Daughters of Charity, founded in 1633 by St. Vincent de Paul and St. Louise de Marillac. These weren't cloistered nuns. They were active sisters in gray habits and white cornets, going into homes, streets, hospitals. Vincent said their convent was the houses of the sick, their chapel, the parish church, their enclosure, obedience. They ran soup kitchens, orphanages, they battled epidemics, and nursed on battlefields. By the 19th century, they inspired even Florence Nightingale, who observed them and praised their training. So Florence Nightingale was taught by Catholic nuns and Catholic nurses. But now the big question, how did they actually care for the sick without big pharma? No penicillin, no aspirin pills, no labs. No. Treatment was supportive, natural, and filled with faith. Herbal medicine from gardens, physical gardens. Every monastery had an herb garden. Rows of raised beds with medicinal plants. Monks and nuns grew willow bark for pain and fever. That's nature's aspirin. Opium, poppy for pain relief. That's where morphine comes from. Chamomile and mint aids in digestion and calming the nerves. St. John's wort for wounds, moods, depression. Lavender, rosemary, sage. They made infusions, decoctions, poultices, salves, tinctures. Hildegard of Bingen in the 12th century wrote entire books on herbal virtues from her visions and her garden work. Also supportive basics like cleanliness. They emphasized it more than most realized. Nutrition, broths, bread, wine, and eggs. Sounds like my diet. Rest, warmth, and even sunlight. Wound care, bandaging, cleansing with wine or herbs, bloodletting. We don't do that anymore. Cupping, common then, really good for lung respiratory issues. And though we know a lot more now, is it better? And then most importantly, Catholic nursing was based on prayer and the sacraments of the church. They were seen as the most powerful medicine, the intercession to the saints, the relics, the holy water, confession, faith, healing, all complemented by herbs. During the plagues, like the Black Plague, the Black Death it's called, sisters stayed out nursing the dying while others fled, kind of like COVID. Nurses stayed in the hospitals and worked while everyone else fled. In wars, they followed armies. Their disciplined, vocation-driven life allowed consistent, compassionate care despite limited science. Nightingale herself drew from this tradition. She visited Daughters of Charity houses, admired their organization, and even took Catholic sisters to the Crimean War. But she secularized it, removing the religious vows, focusing on training in schools. So pre-Nightingale, Catholic nursing was vocational first. It was a service to Christ. It was not a career. In our era of depersonalized medicine, we can learn from this, from our Catholic pre-modern nurses. Treat the whole person. Prioritize charity over profit. Use what's natural first and God-given, and see every patient as Christ. So that's the deep history of Catholic nursing before Florence and Big Pharma. It was a legacy of heroic charity, and it is ours to reclaim. If this resonates with you, please drop a comment or DM me on social media at TradNurse. What aspect should we explore next? Maybe specific orders, or what were the herbal remedies that they used in detail? That sounds like a good podcast. So thanks for listening, and may God bless your nursing hands. Saint Camillus de Lillis is the patron saint of nurses and the sick. Please pray for us. God bless.